afternoon and welcome to My Harlem Portraits, the show that aims at shedding the light on the fundamental contribution of African Americans to the building of this country and on Black excellence. Representing Black excellence today, it's an organization, God's Love We Deliver, which is been founded in 1985. It's a non-sectarian organization that aims at improving the health and well-being of people affected by life-altering illnesses, providing them with medically tailored meals, comprehensive nutrition care, and education at no cost. And to represent this organization, we have Miss Dorella WALTERS, MPA, and Chief Program Development Officer for God's Love We Deliver. Welcome to My Harlem Portrait, Miss WALTERS.
Thank you so much for having me, Maria. It is an honor and a privilege to be with you today.
It's wonderful to have you with us because this organization is not the first time that I'm presented with it in very different occasions with Broadway Inspirational Voices, for example, which is also one of organizations that support this. And I know that the work you're doing is fundamental and very important. Your website starts in this way. The incipit is this: being sick and hungry is a crisis that demands an urgent response. Tell us a little bit about your organization. That is so amazing.
Thank you. Well, God's Love We Deliver started as a direct response to the HIV/AIDS pandemic. And then when our medication started to work better for people living with HIV and AIDS, around 2001, we expanded to serve other diagnoses and illnesses such as cancer, renal failure, severe diabetes, and severe heart disease. So our approach, our core competency is supporting someone that is dealing with a serious life-altering illness through the provision of nutritious, medically tailored meals that are designed by a registered dietitian nutritionist.
And you take them, you take these meals to them.
We do. We deliver to each individual and their family. So, any children they have in the home, or if they have a caregiver in the home, we are providing those meals. Because at the time that someone's experiencing a severe illness, there is a lot of stress often, and what does not get paid attention to or what may fall away is the way that everyone in the home is addressing their nutritional needs. So our intention is to provide this service so that the individual has one less thing to worry about and can concentrate on their overall health. If they need to be going to treatments like chemotherapy and radiation, when they come back home, they should have something that is delicious and nutritious and appetizing to eat.
Wow, it is amazing. And tell us a little bit about the education.
So, our registered dietitian nutritionists always provide education to the individual and to the family, as well as to all of the communities that we serve. Why is that important? It's essential for people to understand the power of nutrition. We believe in making sure that we provide medical nutrition therapy. So, what does that mean? That means that we are pairing the education that looks at an individual as themselves, their culture, their preferences, their allergies, anything that is specific to them, and then matching that to what is going on with the meals that we're providing. Not everyone will start learning at the same place.
Mhm.
Therefore, it is through consistent conversation, through materials and visuals that help the individual and their family support system to understand the value of proper nutrition. And we try to do that through the lens of the various cultures that we're serving. We want to be respectful and compassionate of everything that's going on with an individual. Perhaps there's some cognitive disorder, perhaps there's some ambulation challenge, meaning they can't open a can or they can't actually kind of open their own freezer. So we want to make sure that we're helping them see the possibility of getting the right type of nutrition in a variety of ways.
This is fundamental because this education you give while they are sick is going to be something that they will take with them in their everyday life. And that's fundamental because you can't just eat well while you're sick and then start eating bad again. So,
Correct. So it's very profound. It's so interesting that you mentioned that because we also have a new program and we call it our Health Harvest program. So it's for individuals that have improved in their overall diagnosis or health status, and they've improved to such an extent that they've graduated off of the medically tailored meals and are now receiving medically tailored groceries. But they continue to get the nutritional education from the dietitians to teach them how to cook these new foods, quinoa, feta cheese, including it, all of these ingredients to helping them be in whatever state of self sufficiency as it relates to their health, whatever they want to reach. We're trying to help support them in that.
I think this is fundamental. I'm going to give you my theory. I'm Italian, so we are used to eat well, and we're used to have, because of European Union, which is where I used to work, we have a very high standard of food security and food safety. And I've seen since the pandemic until now, people dying here. I know so many people, so many friends of mine who passed here in the States. I don't have any friends who passed in Italy. None.
Oh, wow.
None. So that tells me that something here is not working right. And I think the fundamental thing is the food, the nutrition. I really believe in that.
Yes, we understand that with such a large country and such kind of growing opportunities of what food could look like, that's why God's love always concentrates on everything being freshly prepared here on site.
Yeah,
There's no starters or preservatives or fillers in our meals. But at the same time, we know that the world is full of things. So that's where the nutrition education comes in to help people have a better understanding about what they're consuming and how it would affect them either because of the medications they're taking or because of the diagnosis and comorbidities that they might have.
fantastic. Yeah. As Chief Program Development Officer, you are responsible for client outreach and establishing community-based and healthcare partnership for the agencies. Sorry. Tell us a bit about these important responsibilities you have.
Thanks, Maria. So we understand that we do not have the responsibility, nor do we have the capability of providing all of the care that our clients need. So it's imperative that we have relationships with all kinds of providers, hospitals, health systems, other community-based organizations. So in terms of my role and my team's responsibilities, we are building relationships in all of the communities that we serve. The people that we serve, we're not interested in their citizenship status. We just want to make sure that they know we exist to support them. But at the same time, we know that there are individuals, let's say, that are getting care through their insurance plan or through a particular sister organization. So we build partnerships that might include signed agreements, contracts of some kind where God's love is providing the meals and another organization may be providing care management
Mm.
or maybe providing some other type of education or work study program so that then people, as they're elevating or evolving in whatever their health status is, that they have another organization to be working with. So we have found through outreach and engagement that once we do a presentation to a particular facility, that's one presentation. Because sometimes there is turnover, people move on to other roles, etc. There's the loss of institutional memory
Mhm.
about what God's love we deliver is and who we what we do. So we're constantly spreading the word that we exist because sometimes suddenly people may get diagnosed with cancer and they're like, I just can't eat anymore, I can't tolerate anymore, and then someone will say, oh, but have you reached out to God's love? So that's where that engagement and partnership comes from.
Fundamental.
Yes, yes,
Absolutely fundamental. Networking and creating a network that stays with time. Even if people go away, there are other people who will be able to do that. That's fundamental.
exactly.
Fundamental. During your tenure of God's Love, you held many different leadership positions, which gave you a very unique insight into the clients and the community that your organization serves. For example, under your leadership, the organization expanded the types of diagnosis, like you said before, population served, and its revenue portfolio, which is reaching now more than 7,000 new clients a year. How did you do all that?
I think it came from just concentrating on the work and trying to get to the next step. I'm a firm believer of understanding that there's a path. So I can tell you about our contractual relationships. God's love had never even thought that that was possible. And when we partnered with our first insurance plan and we saw that the patients they were covering were the same as our own client patient population,
Wow.
we were like, well, we should be serving them all. So it was an opportunity to bring in additional revenue into the organization, further diversify the coverage of our mission, and just continue to pursue that. And I think it stems from what we were speaking about earlier in terms of the importance of relationships and partnerships and people believing in the mission, right? And understanding the impact of that. So that's where we were able to leverage these new contractual pathways, an opportunity for research partnerships as well, to further the belief that medically
Yeah.
tailored meals and good nutrition is something that is powerful. So how do we create a body of work that demonstrates that impact through research? So I think it's about dedication every day, collaboration with my colleagues here, and then also understanding that you cannot be successful alone. You have to build a community, and that's something that God's love has always provided.
Yeah, you got everything right.
Thank you.
But this, I think this has a lot to do also with the fact that we are women, because women reach out for this connection. We want the connection. It's, I think it has something to do with, it's in our DNA. We don't want to be isolated. We don't have the ego. Let's say, I want to be the
Right.
main
It's
woman. We connect and we cooperate and collaborate. I believe firmly in that.
agreed.
You lead the business development client services, healthcare partners, and nutrition services department, which are the first line of contact for your clients, for their family, and the medical and social service providing care for them. Tell us a little bit more about that. You have already talked
Yes,
about
yes.
it, but go a little bit deeper in that.
Sure. So think about the experience from a person that may suddenly be diagnosed with an illness. They know God's love by name, so they call in. I have always said and believe that that is a bold moment, right? Is a brave moment for someone to pick up the phone and say, "Can you help me?" So our team in program services, client services, they answer that phone with compassion and respect for the
Mhm.
individual that's there. And our goal is to get them started on the meals and get them connected to the dietitian that will have that deeper conversation about the details of what they can consume, what allergies they have, all of that kind of becomes part of the process. And then once people are enrolled in the program, then it's about relationship building and customer service, being responsive to these individuals, both the clients and the providers that refer them. We are, along with our drivers, because the drivers are also frontline going into the homes of our clients, it's all about who we are representing. And we're representing God's Love We Deliver's mission. Our intention is to demonstrate love in all that we do, that we care about our clients, that we care about the communities that we're delivering in, So that's the teams that I'm working with here, and it's an honor and a privilege to work with them.
It's a beautiful thing. Nationally, you lead the Healthcare Partners Committee and the healthcare track at the annual Food is Medicine Symposium. Tell us a little bit about that.
Sure. So the Food is Medicine Coalition is a group of providers that includes organizations very similar to God's Love We Deliver. They are across the country. Think Texas, Georgia, California, and Florida. They all do medically tailored meals and medical nutrition therapy. What we try to do is build a community of learning across the country so that smaller organizations can build their capacity
Mhm.
in terms of serving more people, but at the same time, for the healthcare partnerships track, which I co lead, the intention is to help our sister agencies have a better understanding as to how our medically tailored meals relates to the policy changes in healthcare, so that then if they enter into partnerships that are potentially reimbursable with hospitals and in health insurance plans, that that's happening across the country. Because if all of us end up doing that, which is the goal, then we can further the research that demonstrates the impact of these kinds of services. It's not just limited to one area of New York or California. So it's been a privilege of mine to support them and to be part of that group. There's always constant learning. And at the same time, we want to mentor and grow, let's call them younger workers, younger people that are entering the field of food as
Mhm.
medicine, so that they can continue to take the work forward, right? And continue
Yeah,
to serve anyone that may be dealing with illness.
wonderful. Uh, this is really the most important work I've seen until now, really.
Thank you.
Yeah, it's a base. Without that, nothing else works. You have recently represented the agency in the Gravity Projects partnership with the Coding for Food Medically Tailored Meals workshop. And you are a member of various boards and committees. For example, the PHS Whole New York City Social Care Network Governance Committee. You are on the advisory board for the New York City Department of Health's project with the National Institute of Health, and you are a member of the Advisory Council of New York State Food as Medicine Coalition. I mean, how do you manage all that? Tell us a little bit about all these organizations.
There's a lot happening out in the world around food is medicine. And I'm honored to support and collaborate with all of these institutions that you've mentioned. So I can give you some framework. So New York State has the opportunity to look at serving people that are on Medicaid in very innovative ways. And one of the innovative ways is by looking at the spectrum of food and nutrition, and one of the services is medically tailored meals. So that's where I'm able to support the social care network of Public Health Solutions and other social care networks across the state, so that they can really begin to look at who are the people that perhaps they didn't know were dealing with food insecurity and illness. because if people are potentially engaged in care with a doctor, it's possible they never show up on the radar as
Yeah.
a group of individuals that could need a benefit from a little bit of extra help. So the coding for food and the Gravity Project and initiatives like that is operating through the lens of policy to really create billing codes that would correspond with medically tailored meals and the types of services that fall under food and nutrition. And that would help both clinicians and insurance plans to have a greater clarity as to the type of nutritional interventions they could prescribe for their patients. So we're getting there. There's a process happening, but it all is about collaboration, as we were talking about earlier.
Yes, and you are definitely doing a great job at that. So thank you for what you're doing with this organization. And let's try to talk about the Beacon Theater. It's
Yes.
called
Our,
Love Rocks. Tell us about it.
exactly. So, Love Rocks, we're so excited to be celebrating our 10th year at the Beacon Theater. It's our biggest fundraiser of the year. It is an opportunity to tie in the power of food as medicine to art and music and really have that sense of community. We are excited and thrilled at all of the performers that have loved and supported us through the years, and new ones that come along as well, and they're helping to raise money for us to be able to serve even more clients.
And tell us who's performing tonight, because there are some amazing performers tonight.
Yes, so we will have Paul Simon, the Goo Goo Dolls. We're going to have Mary J. Blige. We're going to have some surprise performers as well. Our speakers will be Whoopi Goldberg. We'll probably see Bill Murray as well. So there's a lot of people on the roster, and we're so excited. Jon Batiste will be there,
Oh
and
my
there's
God.
a rumor that there's going to be a whole New Orleans line opportunity. So we're so excited.
This is so amazing. I discovered it last year and I came to this Love's Love Rocks concert, and I couldn't believe the quality and the entertainment and the community and the love that was built all around this. And I think this is so fantastic because linking the two major, for me, I think, reasons why someone feels well, is healthy, is the food and the food for your soul. The food for your soul is the music. Fundamentally
Agreed,
is that.
agreed. It's very powerful. We have often used music through partnerships with other organizations to provide that to our clients as well, because so many are so isolated, right? Sometimes it's only our driver that they might see. So it's a powerful testimony to the power of our mission and the music of the Love Rocks concerts.
Which is a big family. I'm very excited to be participating in that. And how did you, how did they imagine that? What made that
Wha-
connection?
It's so interesting because one of our current board members really loves music and wanted to find a way to further support the organization. So, through thinking about it, relationships he had in the music world, said, well, why don't we just do a fundraiser that includes performances like a big concert? And that's how it started. And the Beacon Theater has been such an amazing partner to us. It's just wonderful. It's such a staple in our city of New York City, and it's an honor and a privilege to partner with them and their amazing team.
And it is an amazing theater.
Oh, yes.
Amazing theater. I think it's the most
Beautiful.
beautiful theater I've been at, especially here in New York. It's fantastic. So, Mary J. Blige, Whoopi Goldberg, Paul Simon, many, many more. Willie is the artistic director, the musical director.
Yes, yes.
Willie, the bass player, been on many late night shows. I met him
Exactly.
30 years ago. 30 years ago. I don't think he remembers me, but we met 30 years ago when we were both living in the village. And I had
Wow.
no idea who this guy was. I just remember that everybody was coming and asking for an autograph from him. And I was thinking, who are you? Why is everybody asking you for an autograph? Because I wasn't living in the States at the time. I was living in Europe and we just met in the village and that's how I know. So I know his passion also for music is fantastic. And this concert is just amazing. So thank you again for
Thank you.
what you're doing. And thank all your team and all the people that we participate tonight in the show.
Thank you so much. You are a wonderful and bright spirit. So I thank you for this time that we have spent together. It's been an honor and I appreciate you. And let me,
I
sounds
love
good.
you. Thank you. And thank you, our viewers. See you every Saturday, 12:30 on Spectrum, 12:30 p.m. on Spectrum and MNN HD. And for the past episodes on My Harlem Portraits, my YouTube channel. Bye bye. Thank you again. Bye.
Thank you. Bye bye.
Bye.